Before we turn to the substance of the meeting today, we are going to begin by having Rick Erdman, who is the head of the board that is in charge of this committee, talk a bit about the IOM process so that all of you in the room and all of you, thankfully, who are listening on the internet or however you're doing it can know exactly how our process is going to proceed. And then once he finishes, then I'm going to welcome everybody enthusiastically.
Thank you very much, Ellen. As Ellen said, my name is Rick Erdman. I am one of the board directors here at the Institute of Medicine, and it's my pleasure to highlight some of the key features of our study process and how we operate at the IOM. In fact, the study process is the same whether or not we're talking about the IOM or any of the institutes within the national academies. All of the NRC reports, for example, as well as the IOM reports, follow the same process. So I will use the term academies in my comments. The study process the IOM uses was actually developed and refined over 150 years, ever since the National Academy of Sciences was chartered by Congress in 1863 during Abraham Lincoln's administration. And the purpose was to mobilize science to assist the government. Of course, at that time, it was the Civil War. But since its very inception, the charter stipulated that the Academy would be a separate and independent agency from the government, and that the advice would be provided voluntarily by experts identified by the Academy. And to this day, there are no government appropriations given to the National Academies each year. Our funds come to us from sponsors who are requesting assistance. So back to the study process itself. What I'm going to do is highlight the four major stages of our studies. The first stage is really to define the problem. When a sponsor approaches the Institute of Medicine or any part of the National Academies with a problem, it sometimes takes a while to clarify the scope and the elements of the study. That needs to be clear to both the sponsor and the academies before the work is done. When this is accomplished, the sponsor can then prepare a contract of work for us. The second stage of work entails the selection of an expert committee of volunteers who will author the report. The selection is accomplished by an extensive search for the most appropriate candidates to accomplish this work. The search includes many sources to find and then vet the best candidates. Once a slate of nominees is prepared, it goes through a series of internal Academy review and approvals, including the President of the National Academies, before the provisional slate of members is accepted. I say provisional because the committee will engage in a special session prior to its first public meeting where its provisional members will have a discussion with the Academy's leadership and among themselves to identify any conflicts of interest or to ensure proper balance of views. Once this has been carefully considered, a final decision is made by the National Academies to grant membership to the provisional member, or not. There's also the opportunity for the names of provisional members to be publicly viewable on our website with opportunities for public feedback. Now the third stage of the study is where the bulk of the work is done. It involves the committee meetings and the gathering of information based on public presentations and research by the committee and the staff. During this stage of the process, the committee deliberates around the evidence that it builds in an iterative fashion. Any information provided to the committee from outside sources is listed in our public access file for anyone to see. Yet deliberations of the committee are done in confidence so as not to be influenced or directed by external interests. This is the stage where the committee drafts its report, again in confidence. The committee staff generally provides progress reports to the sponsor, but these are administrative in nature and the actual deliberations of the committee are not revealed. Every effort is made to reach consensus on the findings and conclusions built on the evidence, since that gives added value and credibility to our reports. The draft report, however, is not available to the sponsor or any other outside agent. In fact, the study is not done at this stage. It goes on to stage 4. The fourth stage of the study process is a rigorous, and I mean rigorous, peer review process. The slate of volunteer reviewers are nominated that roughly match the expertise of the multidisciplinary committee membership itself. That slate is also subject to internal Academy review above and beyond the purview of the study committee. The reviewers independently, individually, and confidentially review the draft report. They are asked to make critical comments about whether the committee adequately answered the study task questions, to clarify any errors they believe were in the text, and to offer new insights and suggestions. Reviewer comments are returned to the National Academies and provided to the study committee in an anonymous fashion, that is to say, reviewer A, B, C, and so on. The committee is then required to address each and every comment and make appropriate adjustments to the study draft. Very importantly, this process of modifying the draft is refereed by yet a third neutral party, and that party is called the Academy's Report Review Committee. The Report Review Committee, with the assistance of two esteemed representatives called the Monitor and the Coordinator, summarize the major areas they have noted from the review process and ask the committee and staff to ensure that these areas are adequately addressed in the final draft. Only when the Report Review Committee believes that this has been accomplished will they approve the report and allow it to be publicly released to the sponsor and to the public. So those are the key highlights about how we do our work. So I will say that the National Academy uses a very systematic study process that is independent from the sponsor and all other external agents. It is based on a body of evidence developed by a multidisciplinary group of accomplished volunteer experts who aim to reach consensus. And their final work must be seen and further modified after it is rigorously reviewed by peer experts before it is considered completed and released to the public and to the sponsor. So that gives you a broad idea, I think, a general idea about how we do our work.
Thank you very
That
much.
concludes my comments.